Okay, I'm going to explain the process of inserting a Foley catheter and demonstrate it on our nice mannequin here. Prior to any procedure, you always want to remember things like washing your hands first, gathering your supplies, making sure you have the proper working environment before you go to actually perform your skill. Specifically for Foley catheter insertion, you're going to stand on the side of the bed that's your dominant hand. So for myself, I'm a southpaw, I'm left-handed, so I will stand on the patient's left side to insert the Foley catheter. You can use your tray table or bedside table as your workspace. You would want to clear it off and make sure you have adequate room before doing any of that, but you can use the tray table, it's optimal. Make sure you raise the bed to your height to a good working environment. So I'm going to raise it up just a little bit more. And then you're going to have to position your patient in the proper position for insertion. Now, before you even start getting into your sterile supplies or opening the kit, you may have to perform some perineal care, which is pretty common. You might not have to, but it might just be something to think about when you're gathering supplies. So you want to uncover them. We want to cover what we can to provide privacy and just comfort for the patients. And we're going to position for our female sort of in this position here in the lithotomy position, or like they're in the stirrups. And then we're going to begin the process of, I've got some arthritic hips there. We're going to begin the process of inserting the Foley catheter. So, and unfortunately, with Foley catheter insertion, you will see some variations of the same procedure depending on how your equipment's packaged, depending on what facility you're working in, or just who's doing it. The main principle is to always maintain sterility. You're going to learn a little bit about sterile technique in the coming weeks, but that's what you have to think about, is maintaining sterility when you're inserting a Foley catheter, because CAUTIs, or catheter-associated UTIs, are very prevalent, and hospitals get dinged when they have a CAUTI. So when we're opening our package, we're going to open it, and you're only going to grip the outer 1-inch border here, because in any kind of sterile procedure, the outer 1 inch is considered contaminated. So we want to be sure that we open it by only touching the outer 1 inch. And this is going to be my trash bag here, and so I'm going to put this here. And in this particular Foley catheter kit, the sterile gloves are on top. So I'm going to go ahead and don my sterile gloves, but before you get sterile, you have to make sure that everything here is as you want it to be, so that way you don't have to try and do something with your sterile gloves, then have to sterile up once you've touched something that's not sterile. But for us, I'm going to go ahead and grab the sterile gloves. So you have to be sure that you have enough room to glove. A part of sterile technique is always visualizing your sterile field and being sure you keep everything that's sterile waist up. So that's a part of sterile technique, which we will go over, or Ms. Alexander, I believe, goes over in class. So I'm going to open up my sterile gloves here. I'm going to put on they ripped, but we're going to keep going. Just know that they ripped, and in real life you would change these. Alright, so now I've got my sterile gloves on. I can kind of assess my equipment here, see what I've got to work with. There's usually a tray and your box here. You also have 2 different drapes in your Foley kit. I've got this one drape, which is just a solid square, and I'm going to place it on the bed itself, and I'm going to place it shiny side down. The only thing, I'm sterile, so I have to be very sure to watch where I'm touching. So when you place it like that, you place it and you cannot touch anywhere outside of that 1 inch border, and you want to be sure your gloves don't hit the patient's legs or the perineal area. Next is going to be the fenestrated drape here. You can see the opening. You can place this over the patient's vagina, or if it's a male, it would be right over the penis. I'm going to lay this down, taking care not to touch anything outside on the patient, and if it falls like that, I'm gonna not, unless I want to redo it, I'm not going to try and correct it unless I can correct it without contaminating. So I'm going to see if I can fold this up or try and get it to stay. So now that I've got the main drape on the bed, the fenestrated drape here, then I'm going to look at the rest of my kit. You have, in your kit, you have simulated swab sticks, which we're going to, in the hospital, are going to be betadine swab sticks. So I'm going to go ahead and open those up and make sure I have them ready. I've got my sterile lubricant here in my kit, so I'm going to open that up and squirt it out. I've also got a syringe here that's got your fluid in it. This is what you're going to attach to the port to blow up the bubble to hold your Foley catheter in place. Now, this kit has plastic that is wrapped around the Foley, so I'm going to have to take that plastic off before I'm actually ready to insert. When you take it off, you have to be careful to hold on to it, otherwise it'll flop around and you may contaminate it before you even get started. So I have got my betadine here. Now, here's where you have some variations. One spot that you have variation is that some people will pick up their entire drape here with the boxes intact and push it over there. Some people will just pick up the box itself and put it right in the middle. In this particular situation, I feel comfortable about doing it right where I'm at. So I'm not going to try and move it because that would be more risky. So I'm going to be sure I've got the tip of my Foley catheter lubed up in the lube here, and that's going to stay intact. Now, I'm going to contaminate my non-dominant hand by holding the patient. If I'm holding a female, you have to be sure that you open the lips as much as you can and that you clean thoroughly around the inside of the lips and then in the middle where the urethra is. So I'm going to contaminate this hand. So now this hand is going to be used for cleaning and for insertion of the Foley catheter. So I'm going to clean, and I always get confused. It's far, near, middle.
A nuclear missile, away, near, middle.
I like it. A nuclear missile, away or far. And then also you have to be careful not to go across your sterile field. You want to be sure that you go around it. So I'm going to go around it, and my garbage bag's falling over, but you know what? I'm just going to toss it on top of it. So that's far or away. Then I've got near or nuclear. I'm going to go around again. And then I've got missile or middle. So I'm going to clean the inside. Next, once I've cleaned thoroughly, I've already lubricated the tip of my Foley catheter, so I'm going to pick it up. Some people like to pick up the whole bag with their pinky just so you don't have as much, resistance. I'm going to begin insertion. Tell the patient that it's going to pinch or they're going to feel some pressure. And I'm going to insert it. For males, you'll always have to probably insert it further, but you want to insert it until you see urinary return. So once I've got it inserted, I'm going to hold it in place. And now I've got my syringe here that I'm going to blow up the bubble. So I'm through with that, and then once you've inserted it, you feel like it's in place, you've got good urinary return, then you're good to place the patient in a more comfortable position and then clean up after yourself. One thing to remember before we sign off is that you're going to have to hook this urinary drainage bag to an immovable part of the bed frame. You never want to hook it to a side rail. And then in the hospital, a lot of times we have a little secure device that will tape the catheter, secure the catheter to the legs. There's not a lot of tugging. Also, we might just put a piece of tape over that to make sure that it's secured there. And then, I can't remember, I don't think there's an official above the knee or below the knee.
P below the knee.
Huh?
P below the knee now.
We put it below the knee here, and then you always want to be sure that the bag itself is below the knee or below the level of the patient, because you'll have backflow into into the bladder, and that can cause a urinary tract infection. So then you clean up. And I'll put all this into my garbage bag, and then it all belongs in a biohazard container. We'll leave our patient in a comfortable position, and be sure to leave them safe by raising the side rails, lowering the bed back to the floor, and leaving the call light within reach.